The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and thank you for joining today's webinar. As we get started today, just a couple of things to point out. Everybody is in listen-only mode, so if you have questions, feel free to type them in. They can either be public or private questions, and I will do my best to get to those before the end of our webinar today. So, over the course of the next hour, I'm going to give an introduction to our software services that we provide to brokers. Kind of a real quick overview and short version of it. Basically, if you look at this website, what our software is all about is the fact that you don't have to send your clients here to enroll into the Affordable Health Care Act plans, the Obamacare plans, whatever it is we choose to call them, and right now it's probably not very nice things. The fact that this site has now been live since October 1st and still is having as many problems as it is beyond ridiculous and incredibly frustrating, but I don't need to tell you guys about that. What concerns me is that we have, if you want coverage for January 1st, we've only got until December 15th to apply for a January 1st effective date. I'm on conference calls with CMS almost every day. There is a real big push to get these bugs worked out by December 1st. They are making some headway. I'm not convinced that they will have it all worked out by December 1st, but I think by December 1st that this website should be flowing better than it is today. The biggest issue still, of course, is even if this website is working properly, if you are sending your clients here to enroll in Obamacare plans, there's quite the tedious process that they have to go through. And as part of that process, they have to put in your name as the agent and also your NPN number. If they don't do that, then you don't get credit. You're not the agent. So I want to kind of I'm going to jump around here a little bit. Bear with me here for 1 second here. This slideshow that I'm trying to pull up here kind of demonstrates a couple of things that we're going to talk about today. So first off, what I want to point out is that we are set up as a web broker through CMS, and so the services that we offer to brokers through our software is part of our web broker connection. Part of what I find very frustrating about the healthcare.gov website is the order that they do things and the manner in which they do things. So first off, somebody going to the healthcare.gov website, very first thing they have to do before they can browse plans or rates is create an account. Then they have to go through the identity verification and then the subsidy application. And if any of you have played around and looked at that subsidy application, it is extremely tedious and time-consuming. And then finally, after all of those steps, they can make a plan selection and then verify that they are enrolling in a plan. And at any point in that process, it's real easy for clients to forget, and it's actually in the subsidy application where they do it, to forget to put in your NPN number, and they may have misplaced that or just forget to do it. And then you've lost your clients. So maybe a client you've had for years that realizes, hey, I can get a subsidy, I need to move to one of these Obamacare plans, and if they don't put in your NPN number on the healthcare.gov website, you're no longer the broker on it. So a couple of comparisons when you're utilizing the public exchange, the healthcare.gov, all of these 5 steps take place on that website. The system that we have set up, you can see that really only 2 of the 5 steps take place on the healthcare.gov website, and the rest of the steps that your client goes through actually takes place on your website. The other thing we've done is we've messed around with the order of things. The first thing we do is show the plans and the rates right up front. In fact, we show the subsidy, the effect of the subsidy right up front as well. And that really kind of gives your clients momentum to go through the account creation process eligibility verification in the subsidy application. Why go through that subsidy application if I don't know or have some pretty good indication that I'm going to get a subsidy? And then if you have clients that are not going to qualify for a subsidy, let's just send them directly to carriers. That application, which is all electronic and built into your website, takes less than 5 minutes to complete. So not only do we mess with the order, but most of these process steps actually happen on your website. And since the enrollment application through our software happens on your website, we control the entering in of the NPN and the FFM number. It's automatic, along with your agent name, all of that information on every single one of the applications that go through your website has your NPN number on it, so you know you're going to get credit for it. So I'm going to go back to the original website that I had pulled up, which is our website, IOIxSoftware.com. This is the website that we use to market and talk about our software services. The main thing that we'll be talking about today, and we're already talking about, is the marketplace portion of our software. This is the private exchange portal that's private labeled and built into your website and avoids you having to send your clients to the healthcare.gov website. In conjunction with this tool are the back-end agency management systems. These are not client visible, but are visible by agents to manage and track your business. So there's two pieces of it. There's the connected agent and then the agency central. And this is a complete management tool to manage not only your individual health business, but all group health, dental, vision, life. You can do disability, any type of ancillary products. You can manage that type of business structure through this agency management system. The entire system is a cloud-based system. It's built around a platform of unlimited use and unlimited document storage. It's designed to make you, as an agency, paperless. I know sometimes people are hesitant to go paperless, but I figure, hey, for example, if the Idaho Department of Insurance can be completely paperless, then why can't we use agents? And then part of our servers and our system is we back up all of the data stored on our system in multiple locations, multiple times daily. We've done everything that's reasonably possible to protect against any type of data loss. It's fully HIPAA compliant and ACA compliant. We put a great deal of emphasis on security. There's a lot of PHI, private health information, that is stored in this system. So we have some strict password requirements, password reset requirements, session and login timeouts, everything that we can do to protect all of that client data. So it's really secure, easy to use. We have done this from both the client and the broker perspective, hence our tagline, software designed by brokers for brokers. So everything is built around ease of use. Myself, I come from a broker background. I started a company, Insurers of Idaho, back in 2004. This instant health insurance quote box, which has now become the gateway for all of these private exchange portals we set up for brokers, has been live on this website since January of 2005. So that's kind of my background. That's how this whole thing got started, was with this agency. And then our company, IOIx Software, has grown out of that agency. So really we've done everything from an agency perspective. We've done things in such a way that I think it's really, really easy to use. In fact, if you look at our testimonials, a lot of compliments we get from brokers are on how user-friendly it is, not only for them, but for their clients as well. By the way, too, if you look at our history tab, just by way of disclosure, the agency Insurers of Idaho still does exist. It still does write business. I'm not actively involved in it. I'm more on the IOIx software side. And by way of another point of disclosure, IOIx Insurers of Idaho in March of 2013 sold its group block of business to another agency, signed a non-compete on the group side. Really is kind of a statement that we're not trying to compete with brokers. We want to maintain that broker perspective, so We will maintain the agency with the individual clients that we have. That agency really becomes an incubator and a test environment for a lot of the software we rolled out on a larger scale, testing it internally before we roll it out to everybody. And then no long-term contracts. I think that the software stands on its own merits. It has a great value, a great benefit to the agents. And if that's the case, feel free to use it. But I don't want people using it because they are tied to a long-term contract and don't feel like they can get out of it. So use it if it's of benefit to you, if it has value. And I would state this, if this software saves you from losing one client a month, so for example, if you don't have a software like this in place and you're sending your clients to healthcare.gov to apply and buy insurance, and one of them a month forgets to put in your NPN number, so conversely, if you use this software, it will pay for itself over and over and over again just by you saving one client a month who forgot to put in your NPN number if you send them to the healthcare.gov website. So I think there's tremendous value to agents. So I'm going to kind of go in and we'll start talking about the marketplace software a little bit. I want to start off by showing you this graph. And this is kind of already what we've been talking about. We're now in the open enrollment period, and so many of you that are established brokers out there, you may have hundreds or if not thousands of existing clients. You're also hopefully trying to attract new clients as well, and everything is now funneling over to different enrollment mechanisms for enrolling in one of these exchange plans. Of your existing client block, the super majority of those, I would suppose, are in non-grandfathered plans, so on or before their 2014 enrollments, they are going to have to move to one of these new exchange plans. If you don't have a private exchange portal set up, really your only choice at this point in time is to send them through the public exchange. And when you do that, you're hoping that they're going to remember to put in your NPN number. If they don't do that, you're no longer the broker, you've lost that client. So there's a better way. The better way is this. Reach out to your clients now. Invite your clients to come to your website. Build a private exchange portal on your website, and we'll show you how to do that. In fact, we take care of the whole thing. When the clients come to your website and use your private exchange portal instead of going to healthcare.gov, there's absolutely no risk to you as the broker. There's no hope left involved. Every file that is sent over to healthcare.gov, every enrollment file, will contain your NPN number. So how do we do that? I had mentioned earlier that this is the website that started it all. This is the gateway. So if we look, for example, this is a site that's owned by IOIx Software. If we go to exchangeplancomparison.com, we can see we have that same quote box, but the whole look and feel of the website is different. It is a different website, and it will brand Exchange Plan Comparison all the way through the process. Here's some examples of other websites that belong to brokers who are using this service. So you can see this particular website, Shores Insurance, their instant health insurance quote box has a completely different look and feel. It looks like their website, and it will all the way through the process. If you go through the quote engine, it will make reference to Shores Insurance. It will keep this header all the way through the process and never mention IOIx or Insurers of Idaho. Same thing. And on this particular website, you can see they've actually changed the name of it to Marketplace Quotes and Purchases. So these are completely customizable. It's set up as an iframe, so it can be easily dropped into your website either by us or by whoever's managing and maintaining your website. By the way, if you do not have a website, you really do need to have a website to use this service. The only other option is if you wanted to use our generic theme website, the Exchange Plan Comparison. But if you're going to write any type of business, I'd highly recommend you have a website. We do have a service for a flat fee, I think very reasonably priced, where we can build you a website. Here's another one. As you can see, this follows the look and feel of the broker's website. And there's just dozens and dozens of examples. And so really all that's missing is putting this quote box, whatever we call it, on your website. So for today's demonstration, I'm just going to demonstrate it on the Exchange Plan Comparison websites. By the way, this website will work with any Idaho or Utah zip code. So just kind of in your mind's eye, Picture this as if it was on your website. The whole process starts just simply by putting in a zip code, and then the plans and rates shown will be specific for that zip code. We ask the tobacco question right up front. The rollover here will kind of describe the federal definition of tobacco use. And then we put in a date of birth. I'm just going to kind of make something up here and click Instant Quote, and it becomes just that. Every available plan for the 83642 zip code that's a qualified health plan is now displayed, and you can see that there is a bunch of them. So you can also see in the background the monthly premium for each of these plans, but notice, of course, the overlay, do you qualify for a subsidy? So what we want to do, instead of showing people the net price, which can sometimes be very scary, particularly in family situations, we want to immediately show them the effect of the subsidy. So hence this little box right here that says, okay, I want to find out, do I qualify for a subsidy? Then there's the disclaimer that this is simply an estimate. This is not the actual subsidy application. This is an estimate. And now, in order to properly calculate the subsidy, there's going to be a series of questions that are asked. First and foremost, do you want to add any dependents to your quote? And I'm going to say, yes, I want to add a spouse. No, they're not a tobacco user. I'll make up another date of birth. And then I will click Add Dependent, so that dependent is now added. And then let's say in this situation, yeah, we need to add a dependent. And the date of birth for this dependent is, we'll say 96. Add dependent. Now I've added a spouse and a dependent. I'm going to click Done Adding Dependents. And now I need to enter in my annual household income. And what we are doing here is we are estimating what we think that income is going to be in 2014. Again, this is for the advanced premium tax credit at this point. A lot of people may have questions about that. So in that regard, we have, for example, a link here that pulls up a page that in great detail explains what the modified adjusted gross income is. So if I think, for example, my income is going to be $42,000 for 2014, then I will put that number in. Then it asks me about the number in my family, not the number enrolling, but the actual number in the family. In this case, it matches the number enrolling, so we're going to say 3. And then, do you or anyone in your household have employer-sponsored health care coverage available to you? If the answer to that question is no, then I can just simply click Estimate Subsidy. However, if the answer to that question is yes, I may or may not qualify for subsidy depending upon the answer to a few additional questions. Does their cost, the employee, to participate in the employer-sponsored health plan exceed 9.5% of the employee's adjusted gross income? If the answer to that question is yes, then I qualify for subsidy, and I can just click Estimate Subsidy. If it's no, then it's going to ask me a third and final clarifying question. Does the employer-sponsored health plan meet the minimum value standard as defined by the Affordable Health Care Act? Well, what does that mean? There's a rollover there. And in this case, I'm going to say no, and then I'm going to click Estimate Subsidy. So several things have happened. I'm no longer getting a quote for just myself. I'm now getting a quote for myself, my spouse, and then my dependents. And then the premiums that I'm seeing are showing the reflected estimated subsidy based upon this information that I put in. And then, so I can see, for example, I'm at 215% of the federal poverty level. I qualify for a $441 subsidy, again estimated, that can be applied to any of the metallic or any of the qualifying health plans. Since I'm below 250%, I will also qualify for the cost-sharing subsidy, which is available on the silver plans, and we'll talk more about that in a minute. So we have all of this information here. We're showing the subsidized monthly premium. We're showing the January effective date, and then we're showing information for my entire family. And then notice as well, not only is it branding the exchange plan comparison website, but it also will list, because each agent who uses the software has their own customized link, it will have the agent information in here. So in this particular case, it has my name, it would have the agent's phone number, email address, the NPN number, and then even a picture of the agent or a logo, anything can be put into that box. Since we are a web broker with CMS, we have disclosure statements that are required to be a part of this website. So there's the disclosure statements. And then lots and lots of information here. So every single plan is divided into its own box, so to speak. I can see information about the deductible and coinsurance. If I click deductible, because maybe I don't know what a deductible means, there's additional information here. If I want more information about that specific plan, I simply click More Info, and I have all kinds of information that pops up, including a network to the provider directory for this plan, and also the SBC document, Summary of Benefit and Coverage for this specific plan. And I can see, the effects on individual and family deductibles and out-of-pockets, et cetera, et cetera. And then from here, if I return to my quote page, I have the ability on a compare and selected plans basis where I can look at multiple plans from multiple carriers side by side. So I can just kind of scroll through here and say, okay, I want to look at these particular plans. And then click Compare Selected Plans, and I can compare up to 6 plans side by side and see this information in this type of a format. So as a web broker, one of the rules that we have to follow from CMS is that if we show one exchange plan, we have to show them all. We can't pick and choose. And there's a bunch of plans on here. So with that in mind, we have some filter capability that allows clients to filter not only by price, but we can filter by deductible. We can filter by provider. We can filter by metallic level. We can show, for example, just HSA qualified plans. And in this case, by default, we can show just the exchange plans, just the non-exchange plans, or both set side by side. Now, one thing that I might be interested in filtering if I'm an agent helping a client is realizing that they're at less than 250% of the federal poverty level. Let's take a look at just the silver plans because I want to see the effect of the cost-sharing subsidy for this particular family. So now I'm going to click Filter. And as you can see, I'm only looking at silver plans. And so the first one that I'm looking at, which is the Silver Connect from Blue Cross, normally in this case would be a $4,000 deductible. But because of the cost-sharing subsidy, the deductible is actually reduced to $2,900. In this particular case here with Select 12, it's now a $2,400 deductible. So there's a lot of different things that happen when cost-sharing subsidies come into place. So if I actually click here and change this family's income, let's say I change it down to $38,000, and what's going to happen now is that they're going to fall below 215% of the federal poverty level. So they'll actually be below 200. Once they get below 200, you're going to notice things like these deductibles are going to increase because the lower they are on the scale, the more of a subsidy that they get. So at 194% of the federal poverty level, they've now got a $150 deductible, so it's a real significant difference. And you can see that as it flows through. And then if I actually click More Info on this plan and click the SBC document, this SBC document is different than the normal SBC document for a silver plan because it's actually reflecting the lower deductible based upon the cost-sharing subsidy. So we've got all of this type of logic built into the quote engine to really empower you as the broker to help your clients. So you can just send your clients to the website and they can go through this process entirely on their own, but your clients are also going to call you and say, hey, what does this mean and what does that mean? And you can kind of navigate them through this type of a screen and help them find the plan that best suits their needs. Maybe they don't like bridge span or something, or so we can sit there and leave that off, and then all of a sudden we're now filtering it down even further, depending on what the needs are of your clients. One thing that this website gives you the functionality to do is sit there and, for example, play around with income and see the effects that it has on the subsidies, and play around with family size. This type of capability just does not exist on the federal website. So in this case, I've entered in a much higher income. I'm above 400% of the federal poverty level, and you can see that it's gone to monthly premium. It's no longer sitting there showing subsidized monthly premium. But I can play with this until my heart's content. A couple of other things to point out. Because we have somebody under the age of 18 on here, there is information for pediatric dental and vision plans. That only appears when there's an applicant that's under the age of 18. Also, if everybody on the quote was under the age of 30, we would also see information on the catastrophic plans as well. So, a couple of things to point out. Exchange apps interface with healthcare.gov, and I'll explain that more in just a minute, because that is the only way to get the advanced premium tax credit portion of the subsidy, as well as the cost sharing subsidy. But if I get a client that is not going to qualify for a subsidy, and I don't want to send that application through healthcare.gov, and I want to send it directly to the carrier, then I'm going to choose the non-exchange route. Now, a lot of the plans are the same in and out of the exchange. It's just that now we know that these applications are going to go directly to the carrier if the client clicks the Buy Now button. So if I have the exchange ones on, then I'm going to send it through the healthcare.gov portal. So how does this all work? So I want to talk conceptually about how it's going to work in the future, and then also how it's working now with kind of the whole mess of the system not working on the healthcare.gov website. So to start off with, the non-exchange application process is working. So let's kind of show you that to start with. So if I get a client that's interested in purchasing this Blue Cross Silver Connect 4000 plan, let's just make sure that, okay. And I'm going to click Buy Now. And when I click Buy Now, it's going to by default show my effective date of January 1st. It's a new application. It's going to show me as the agent in this particular case. And then I'm going to click Start My Application. And then I've already got some test information kind of put in here just to save us time today. I'm going to say, just for purposes of this test application, that I'm single. Yes, I am a resident in the state of Idaho and have been for 11 years and 11 months. I've got in my email, my phone number, my address, my county, and I click Save and Continue. Whoops, I'm missing a digit here. Did we get that right? Okay, apparently we don't have that right. And now I'm actually into the actual online version of this application. So I can add dependents, or if I'm going to do this application for just myself, I'm going to click Save and Continue. And then it asks a question, and we're pulling this information directly from the new universal application for the state of Idaho, as well as in this case from the Blue Cross cover sheet. And I'm going to say, no, I'm not receiving workman's comp payments, Save and Continue. I can add prior coverage, or never mind, I'm not going to add prior coverage, Save and Continue. And then on this particular plan, I need to indicate a primary care physician. I'm going to say I'm in southwestern Idaho. Doctor is the name of my primary care physician. And then I'm not currently enrolled in Blue Cross coverage, Save and Continue. And then it's real simple here. I just simply need to type in my name if I'm the client doing this, enter in today's date, save and submit your application. And that process is really just that simple. An application has now been sent to Blue Cross for enrollment for this client for a January 1st effective date. And since there is no medical underwriting anymore, the application is also the enrollment. Blue Cross will reach out to the client and obtain the binder payments, but your process as the agent is done. Now, two things have happened. As soon as this has been submitted, it has sent an email to the agent notifying the agent, and it has also sent an email to the client just giving them some additional information about their enrollment. Later on, when I show you the back-end piece of our management system, you would actually, for example, be able to see if we go in, but I'm going to go into a demo management system, so it won't work, but you would actually be able to see that client record as part of the management system, that client record had actually been created just by the act of the client completing the registration page in the online application. So I'm going to swap over here to the insurersofIdaho.com website real quick and just kind of go through the quote engine again. I'm just going to click exit out of that, and we're going to apply by default for one of the exchange plans. And when I click Buy Now, we get this message that pops up. Online enrollment is temporarily disabled due to complications on the FFM, Federally Facilitated Marketplace, which controls all enrollment. Please try again soon. And then the invitation here is please complete this application registration page. This will save you time when application enrollment system is back online. So what we're doing is we're encouraging, and agents are really taking advantage of this, for clients to complete this registration page, and it really will save them time once the federal system is back online. Not only that, but it allows you as an agent to follow up with the client having captured all of this information. So if I go back to the exchange plan comparison, we have taken that box off that says the FFM is temporary down off of this website, just because I want to show you how the process will work once the system is back online for web brokers. So if I click Buy Now, and it is an exchange application that I'm going to do, it's going to, again, take me to this registration page. Notice we have a few less questions being asked because they're not a part of the healthcare.gov application. Click Save and Continue, and then this screen pops up where it says Application for Premium Tax Credit, and in order to do that, you have to go to the healthcare.gov website. And then what is missing from here right now is there should be another blue box as part of our interface with healthcare.gov that says Return to Broker Portal that follows your clients the whole time they're on the healthcare.gov website applying for the actual subsidy application. Once your clients create a username and a password, all of that information that they typed in on the registration page when they were on your website, such as name, address, phone number, all of that automatically populates onto healthcare.gov. They do not need to enter in that again. Once they've completed the subsidy application, the box that says Return to Broker Portal moves to the center of the page and becomes their only option. And then when they're handed back in real time to your website, there's also a file that's handed back that has all of the subsidy information. So when they come back, they will end up on a screen that will look, let's give it a good example here, but they will end up on a screen that will look very similar to the quote page, but it will simply have the plan that they chose on it. They'll have the option if they want to, based upon the actual subsidy information, to change plan selection. They'll basically they'll see the actual premium, they'll finalize the plan selection, finalize the effective date, and then complete the enrollment. Like the other process, it will generate an email to the agent and to the clients, and then we will send the file to the feds at healthcare.gov that contains all of the enrollment information, including the broker's name and NPN number, everything that the broker would see here. And then you can actually follow this process through the back-end management system. So earlier when I was on our website here, I've been talking about the marketplace service. Now I want to show you kind of a glimpse at the connected agent and the agency central pieces of the software. And it's the same login for that. It's just if you log in as an administrator or as an agent, depending on your perspective. I'm going to go ahead and log in as myself, as an administrator. And when you log in here, by default, you come to the task page of this website that shows the whole process for managing and tracking all applications. Now, one thing to consider, that page that we were just looking at is kind of in a transition because currently through now in the end of November, we still have the option for clients to apply for the old plans. So one of the things that a client can do, for example, when they're on this screen, is they can roll back and look at, for example, December 1st effective dates. And when they do that, there's a process now, of course, involved for these plans that involves the medical underwriting. So since that option is still on the table for users of the software and their clients, we still have things like waiting for offers and ready to send because we have pending statuses that are available for applications with medical underwriting. So this screen will kind of undergo some transition as we move away from the plans that go through medical underwriting, and it will just let you know status of people that have completed the registration page as well as actually submitted both exchange and non-exchange applications. This is also a screen where you could manage and track renewals. Some of the other reporting things would pop up here, like if you have clients approaching the age of 65, that pops up here, and then some quick links to some of these other tabs across the top. You can always tell which one of these tabs you're on because it will always appear right here. So for example, if I go to clients, I can now see that I'm on the clients tab. If I go to the report tab, I can see that I'm on the report tab. But this is where everybody lands by default. If I go to the client tab, this is what I think is the most useful piece of this tool. It contains all of the client information for everybody that's in our database, whether they're a group or an individual, regardless of what type of status they're in, if they're a prospect that we're marketing to, if they're somewhere in the application process, if they're a current client, which means they have an active policy in force, or a former client, I can see and manage all of them from this screen. Now, I can run some filters, and I can say, for example, I only want to look at individual clients that have a policy in force and click the filter and notice my list shrinks. I also have the ability up here in the search field where I can type in a client's name, phone number, email address, whatever format I want to use to pull up client records. And then if you think about it, each one of these becomes a virtual file cabinet. So when I click on John Adams in a minute and view his client record, it's basically a file cabinet, a virtual file cabinet that's going to contain all information for John Adams. Now, by default, when you first start using this service and you come to this client screen, it would be completely blank. And there are 3 ways that new clients get entered into this database. First off, anytime an individual application is started or completed, it will create a new client record on this screen. If the application is completed, then it will actually show it in the status of a current client because they've enrolled in a specific plan. You can also manually come in here and create a client. And then the first thing you're going to do when you do that is specify whether that was an individual or a group client. And for example, this is only one of 2 ways that you can get a group client into this database because there is no, at this current time, no group application that's available. The third way that you can get clients into this database is by doing a data import. So if you're going to use the system to manage all of your business going forward, let's start and get everything in here, all of your client records into this database. And we have a format for importing client data. As a general rule, that's included as part of the setup fee unless you carve it out. And we can take basically any type of an electronic file and import your client data. Part of what I like to do to kind of give agents some warm and fuzzy here is if you go back to our software page and you read things like our terms of use and privacy policy, we have things like pledge of confidentiality where you know that your client information that is in that database is protected by all of these different policies that we have in place. All right, get back to where I was here. So anyways, those are the different ways of creating client records. I'll kind of walk you through it a little bit, but let's start off by looking at John Adams' client record. First thing I want to point out is when we get into here and we see all of the information such as Social Security number, date of birth, email, phone numbers, addresses, all of that. This was not entered in by you as the agent, by any administrative staff. This actually carries over from John Adams' application and automatically populates into this database. Of course, over time, things may change. You may need to edit it, so you have an edit functionality to edit client information. And I'm just going to kind of go through these different tabs, which are different folders showing different aspects of the client data. So if there was dependents listed on the application, they would show up here in this tab. Here I can actually see a link to any completed or started applications and view them as a PDF file. Documents, I can upload documents pertaining to this client, such as renewal documents, anything that has a significance or importance that I want to store from a historical perspective. Emails, I can actually see a history of emails sent to this client from this system, whether they were sent automatically or sent by me as the agent. I also have the ability to email the client from this screen. Notice how it will automatically populate the client's email address. I can add additional email addresses if I need to, and then I can send this using the regular mail system or send it using the secure mail system if any PHI, private health information, is included in the email. When I set up my account on here on the Agency Central or Connected Agency, if I go into the My Account settings, one of the things that I'll have the option of doing is adding an email signature so that that automatically appears on every email in the system. There's also a notes folder. The notes folder records the name of the person that left the note and also the date and the time of that note. And notice we can see a history. You can scroll down, and every note that was ever left in that client record would be shown here. Notes are not editable on purpose because they become a nice historical tracking type perspective and could really help you out if you ever ended up in a client dispute. I've always trained my staff anytime they pull up a client record, get in the habit of leaving a note of some kind. Logs is kind of a similar type functionality where it shows every person that's ever viewed the client record. Even if they didn't leave a note, they're going to be in the Logs tab. Skipped over policies. If I've had this client for 5 years and I've been using the system for 5 years, I'm going to see 5 years worth of history here. In different statuses, policies show up in green. Green light means it's an enforced policy. In this case, we see renewed. They had prior policies that had terminated for one reason or another or been converted. Those are different statuses that may show up as well. The nice thing about this type of a screen is I can see history on this client real easily. I can see, for example, that they've actually had a Blue Cross policy since May of 2013 or even older. It was a Simply Blue with a $5,000 deductible. They renewed it and moved it to a $7,500 deductible. And then this shows basic information about this plan that if I click View, I can see much more information about this particular plan from the client. I can see, for example, the policy number, the premium, any type of information I want. And then if I actually use this system to manage and track commissions, I can manage any commission splits pertaining to this client, and then I can actually see the commission history for this particular client as well if I've been using that in the commission system. The only other thing to show you is if I, for example, let me pull up this company, XYZ, which is a group. Group status is very similar. Instead of saying dependents, though, there's a contact tab for group. Under the application tab for group, it just simply says coming soon because we haven't built that out yet. So this is kind of just a general high-level overview of some of the functionality of the back-end management system. If I'm using the system to pay and track commissions, here's where I would manage the commissions, where I could upload or enter in new commission statements. I could then go to the Report tab and run reports on the commission, such as missing commission reports and audit carriers to make sure that they are paying commissions correctly. I can also run reports on my block of business and see clients that are approaching the age of 65. I can run all kinds of reports like this master client list. I can filter it down and look at specific types of policies. If I'm doing this from an agency perspective, I can look at specific agents. I've got all kinds of controls on my data, and then I can even download this, for example, as in an Excel file. So there's a lot of different functionality that is built into this. If somebody signs up and uses this software and wants to use the commission system, we actually have a 4-hour training class just on the commission system. It's probably the most complex piece of this whole software just because of the complexity involved in tracking and paying commissions correctly. But it automatically calculates commission splits. It it really is a neat system to use and automates that whole process for somebody that may be interested in doing that. Other tabs like this is the Applications tab, just lets me quickly view applications. Same thing with policies, and lets me view and filter policies that are in force that I may want to run different types of reports on. So if somebody's interested, you can reach out to me and I can kind of give you more in-depth look at the agency management system. But again, just keep in mind that clients applying for individual plans automatically, it generates not only a client record but a policy record in this management system. And my point that I was trying to make earlier is that if this system saves you one client a month, because instead of sending them to healthcare.gov and hoping they put in your NPN number, if it saves you one client a month because they've now gone to your website and all of that information is automatically included, then this thing will pay for itself over and over and over again. So let's talk about pricing. This is the last week of the current price structure. We've sent out some email blasts. We're having some moderate price increases that will go into effect on Monday. Anybody that purchases the software prior to Monday will be grandfathered in at this price structure. So we got basically two price structures. We have a single agent pricing if you're just an agent going at it on your own, and then if you're part of an agency, we have a base pricing for an agency. A single agent can get the software by themselves for $185 a month, or if you need two logins, because it is set up as a per user per month charge, so it'd be you plus a support login is $250 a month, and then there's an $850 one-time setup fee. Restrictions on this is you don't get some of the agency functionality. You can't, for example, you can't do commission splits in a single agent pricing and that type of thing. But if we get into the agency, this allows multiple agents to have logins, each with their own specific URL and tied to your website, so that we can have multiple NPN numbers depending on which agent login is being used. So on an agency pricing, you pay a base charge of $300 a month, and then an additional $110 for every additional agent on top of two. You get the first two for the $300. And then support logins are $75 a month. So keep in mind, it's set up as per user per month. It's unlimited access. We've got hundreds of thousands of dollars and thousands of hours and years of development behind this software. So we've done everything we can to keep prices low, particularly on the setup fees. But really the best way to do that is just to charge a per user per month charge. And then the advantage to you as a broker using this software is we keep everything up to date. All of our product enhancements, all of the rate tables and everything is all maintained by us. You kind of just sit back and enjoy the software, so to speak. So that basically concludes the demo today for